come.
So Emily, we are now almost half a year after your FFS in Antwerp. I have a few questions. First one is, which problems did you have that have made you decide to have an FFS?
It wasn't something I could easily point to. It was because I'd had my bottom surgery, I'd been on hormones, I was pretty happy kind of socialised as a woman. But whenever I looked in the mirror, and this is something that was really hard to explain to people, I wasn't feeling it in myself. I'd look in a mirror and I wouldn't see the female that I wanted to see. And I wasn't sure if I was just overthinking things or if I just needed more hormones or you know what. But I quickly started to realise that I think it was just my face. It just had those slight male aspects that I was picking up on, and I think maybe some other people were picking up on as well, but mainly me, to be honest with you. But it was bothering me enough that I really wanted to sort it out because I wanted to see that female in the mirror.
Yeah. And what was the reason you came to me for this surgery?
We went to one other surgeon, someone in London, but your practice seemed to know what you need to know what you're doing a lot more. You seem to have a lot more experience. You seem to have a lot more. You seem to have put more time and effort into getting kind of procedures that worked and you were confident with. But it was also a lot more apparent that you cared. It wasn't just sort of a medical procedure. It wasn't just we'll pay you money and then we'll never see you again. It was something that you were obviously very passionate about doing properly. And when you're trusting someone to perform that kind of level of surgery on your face, you want someone who is actually doing it for the right reasons.
Yeah. The aftercare was outstanding.
Staying in the clinic for a week to actually let the swelling go down and have people around you to help if you have any pain or questions was a necessity.
I would definitely recommend to people to do that.
Yeah.
Absolutely.
Yeah, it's how we had to do it in the beginning as well. But then we were lucky enough to be able to buy this clinic and add the guest house. And the result of the surgery, how was it? What has it changed to your life?
Again, it's a funny one because it's not something that I don't notice it in a way, and that's sort of what I wanted. I used to think of myself as trans or someone who was transitioning, or it was something I was always aware of, and now it's just not on my radar at all. I go to work. I'm a normal person. I interact with my colleagues. I can go into a female toilet without worrying at all. It's just not something I even think about. And I always used to think, I have to put loads of effort into my voice so I come across as feminine. I have to make sure I'm dressing feminine. I have to make sure I'm doing all these things. And now that I've had the surgery, I don't really mind anymore because I just know that I pass. I know that I'm confident in myself. I don't have to kind of force myself to do these extras because I know that I am comfortable in who I am. So from a sort of emotional sense, it's been a massive success, and obviously from a more practical sense, it looks good. So I'm very happy with it.
It has made the difference emotionally. It has made a big difference emotionally.
Also to you?
Well, I've noticed those things in her. Before, she would be very careful to get all these other things right and just so. And now she doesn't, and it doesn't matter because she's completely confident, and you are completely relaxed and normal and calm in a way that you weren't before.
Yeah.
Can you say something more about the stay in the guest house, how it was?
Yeah, sure. I mean, we obviously shared a double room, and the first thing we noticed was the free Netflix, which we were very, very happy with. I think we stayed in and binged House of Cards for the entire time, which was actually really good to recover to. But, I mean, the care and the other facilities, I mean, the kitchen being completely stocked out with whatever you want was pretty great. I mean, the food obviously was nice but also sensible. It wasn't kind of food that was going to be impossible to eat. But having things like Coca-Cola and other drinks and stuff is something that you might not think to do, but actually having those things there available, whenever you're in a little bit of pain, or you're feeling a little bit low about your face being all swelled up, having those little things there actually made a massive amount of difference. It felt like a home from home. It didn't feel like we were in a hospital, which was
yes,
really
it felt
important.
more like a B&B than a clinic, didn't it? And yet you knew that you'd got any clinical questions
Exactly.
to be answered.
Well, that was the other thing, having the clinic just downstairs, so we knew we could run down to Ellie or you if you were around. We knew nothing could go wrong really. And then obviously having the night nurse and everyone in the actual guest house itself as well. There were so many people around to help.
Because it was scary.
Yeah.
It was scary, and people all had got scary stories, and everyone was a little bit nervous, and you've got a lot of nervous people to look after, and you did a fantastic job, quite frankly.
Thank you. If you could give your former self before your FOS an advice, would you have one, and what would it be?
I guess it does get better. You do get there. You make it in the end, because when you're transitioning, it is always very difficult, and you're always thinking, am I ever going to pass fully? Is this something that's worth doing? I'm putting an enormous amount of effort into something that may or may not ever be successful, but it can be successful. You can transition well. You have helped me to look the part and to feel like that, and to feel like I finished transitioning. So I would say, just keep at it, and you will get there.
Your mother told us a little story. There's also a disadvantage.
Oh.
Of being
Well, my mum has noticed, because I've recently been ranting a little bit more about work, people not listening to me as much, which my mum thinks, and I'm starting to suspect maybe as well, is down to office sexism, and me actually being treated like a woman, and not having my opinions heard quite as much as I'm used to. Which
you were at the garage.
I took my car in as well to have a routine service, and in the past it's always been a pretty normal, you take your car in, that's it. Whereas this time, the mechanic, was desperate to talk to me. He was showing me everything. He was like, "Oh, this is what was this. This is how you change your oil.
This is a windscreen wiper, dearie. You probably don't know how it works."
So my interactions with other people have certainly.
And I told him enjoy it. I said, "Go for it, enjoy it."
Yeah.
Last question: If someone that is interested in having surgery in Antwerp would like to contact you by email, would that be fine?
Yeah, that would be no problem at all. Yeah.
It's very nice of you.
No problem.
Thank you for the interview.
No problem.
Pleasure. Thank you. Thank you very much indeed.